Good evening. My name is Mike Mazuka. I'm an RN, work at the VA hospital. I wanted to give you a quick little briefing on asthma. Asthma is a chronic inflammatory disease characterized by recurrent, reversible airway obstruction or narrowing of the airways in the lungs. Some of the signs and symptoms of asthma are shortness of breath, coughing, wheezing, chest tightness. Most of the symptoms are episodic. An individual could go through long periods without any symptoms, and some individuals have more chronic conditions where they might have to go to the ER and get treated for that, for any kind of exacerbations they might have due to the asthma, the narrowing of the airways. Some of the comorbidities of asthma are rhinitis, sinusitis, gastrointestinal reflux disease, GERD, obstructive sleep apnea, and some hormonal disorders are also some of the comorbidities that you could have from asthma. Some of the treatment goals that we're looking at is some of the goals are just to treat the exacerbations, maintain lung function, normal activity levels when you're out and about, so you don't feel too fatigued, and the least amount of medicine possible with the minimal side effects. Some of the treatment options are, like, one of the gold standards would be like inhaled corticosteroids, are one of the most effective treatment options that you could do for the asthma inflammation. And also long-acting bronchodilators are another great option that have good effect for the narrowing of the airway passages and to get more air into the system for good control and relief of the asthma. So either the corticosteroids, the bronchodilators. I mean, there's more options, but those are two of the gold standards that we normally use. The mode of action of these medications is they get in the airways, and they open up the airways. Basically, from the inflammation, they kind of just open up the lungs so you have more oxygen into the system. You're able to breathe a lot easier, and your ability to breathe is a lot less, exacerbated from the constriction. One of the gold standards of the diagnosis of asthma would be it's based on clinical symptoms, physical examination, and normally they'll do like a pulmonary function test to see where you're at as far as how well you can breathe. Some of the expected outcomes you would expect is to have, you need a successful plan to deal with the signs and symptoms of the exacerbations of asthma. The management of asthma by medication adjustments, environmental modifications, and increasing lung function and capability are critical components for an individual to successfully experience greater control of the disease process and the management of a good quality of life with asthma. So those is kind of what we expect for an individual to successfully control their symptoms and exacerbations and live the best quality of life they possibly can and have the best breathing ability they can, where they're not always fatigued and always coughing and always feeling terrible. They have a good quality of life. Some of the genetic, environmental, lifestyle factors that we could look at are, so asthma is a condition that likely results from complex interactions between multiple genetic and environmental factors. They're not 100% sure if it is genetic, but it is on the table, and they are thinking it is somewhat genetic for the asthma, and get the family histories and stuff like that. Also, as far as environmental changes, climate change is the big issue. They're thinking climate change has a lot to do with so many new cases of asthma every year. They're talking about that, and climate change is an issue that's being looked at for the possibility of asthma. They're talking about maternal smoking. That makes sense. Any kind of irritant like that would probably could exacerbate asthma as far as smoke. Allergens, that's a big one. Dust, pollen. I mean, there's a lot more. I'm just kind of giving you a brief overview. There's so many more out there. Immunotherapy and even allergy shots, they're saying, could cause symptoms of asthma and exacerbations of asthma. They're shown to increase the risk of asthma, some of those, like the allergy shots and the immunotherapies. So basically, in a nutshell, that's kind of like a little briefing, little overview of asthma. The main takeaway is, asthma is a constriction of the lungs. The inhaled corticosteroids and the bronchodilators help to relieve that. And basically, lifestyle change, medication adjustments, and modification of the exacerbations is the main thing to have a good quality of life and good quality control. Okay? So I wish you have a great night and take care of yourself. Good night. Bye-bye.